March 15th, 2024, 6:43 in the morning. That's when I took my first step without wincing in 15 years. My orthopedic surgeon had told me just 3 weeks before that I'd never walk normally again. "Gloria," he said, looking at my x-rays like they were my death sentence, "at your age, with this much damage, the best we can do is manage the pain." I'm 82 years old and I've been managing pain my whole life, managing my husband's drinking, managing my children's problems, managing my mother's dementia. But this pain in my knees, this was different. This was stealing the last piece of independence I had left. It started in 2009. I remember because my granddaughter Sophia was learning to walk, taking those wobbly first steps across my living room. I was on my hands and knees, arms stretched out to catch her, when I felt it. A sharp crack in my right knee, like someone had snapped a pencil bone in half. I brushed it off. You don't get to be my age without learning to push through discomfort. But weeks passed, and the sharp crack became a dull throb. The dull throb became constant aching. The constant aching became shooting pain that made me gasp in the middle of conversations. I went to Dr. Peterson first. He was my family doctor for 30 years, delivered 2 of my children, held my hand when my husband died. "It's arthritis, Gloria," he said with that gentle smile that used to comfort me. "Very common at your age. Take these anti-inflammatories, do some gentle exercises, and let's see how you feel in a few months." Those pills made my stomach burn like acid. The exercises felt like torture. 3 months later, I was worse. Dr. Peterson referred me to Dr. Martinez, an orthopedic specialist at the hospital downtown. Dr. Martinez was younger, sharper, more clinical. He ordered x-rays, MRIs, blood tests. When the results came back, he spread them across his desk like a dealer showing his cards. "Severe osteoarthritis," he announced. "Bone-on-bone contact. Significant cartilage loss. Mrs. Simmons, we need to discuss knee replacement surgery." I was 67 then. Surgery meant months of recovery, physical therapy, pain medication that made me foggy and confused. I wasn't ready. "What if I wait?" I asked. Dr. Martinez shrugged. "The condition will worsen, but if you're not ready for surgery, we can try steroid injections to buy you some time." Those injections became my lifeline. Every 3 months I'd lie on that cold table while Dr. Martinez pushed a needle the size of a knitting needle deep into my knee joint. The relief was immediate, but temporary. 3 months of walking without wanting to scream, followed by weeks of increasing pain until the next appointment. For 5 years that was my cycle. Injection, relief, pain, repeat. But gradually, the relief periods got shorter. 3 months became 2 months. 2 months became 6 weeks. By 2014, I was getting injections every month, and they barely helped. "The cartilage is completely gone now," Dr. Martinez explained during one of my appointments. "The injections can't work if there's nothing left to inject into. It's time to seriously consider surgery, Mrs. Simmons." I was 72 by then. My daughter Carmen had been pushing me to get the surgery for years. "Mama, you can't keep living like this," she'd say every time she saw me struggle to get up from a chair. "You're missing out on life. Sophia's soccer games, family barbecues, trips to the grocery store. Is your stubbornness worth more than being able to enjoy your grandchildren?" She was right, but she didn't understand the fear. Surgery at my age meant risks, blood clots, infections, complications from anesthesia. I'd seen too many friends go into the hospital for routine procedures and never come out the same. I decided to try everything else first. Acupuncture, chiropractors, massage therapy, herbal supplements, magnetic bracelets, copper compression sleeves. I spent thousands of dollars and countless hours sitting in waiting rooms, hoping someone, somewhere, had the answer Dr. Martinez didn't. The acupuncturist, Dr. Chen, was kind but honest after 6 sessions. Mrs. Simmons, acupuncture works best when there's still some healthy tissue to stimulate. Your knees are too damaged for what I can offer. The chiropractor, Dr. Williams, tried to realign my hips and spine, thinking the knee pain might be compensation for other imbalances. After 3 months of twice-weekly adjustments that left me sore and dizzy, the pain was unchanged. The massage therapist, Linda, worked miracles on the muscle tension around my knees, but the bone-on-bone grinding continued. I remember one particularly bad day in 2016. I was trying to get up from my garden chair after watering my tomatoes. The pain shot through both knees like lightning, and I collapsed back into the chair, gasping. My neighbour, Mrs. Rodriguez, heard me cry out and came running over. "Gloria, honey, what happened?" she asked, her face full of worry. I couldn't speak for a moment. The pain was so intense that it stole my breath, my words, my dignity. "I can't get up," I finally whispered. "I can't get up." Mrs. Rodriguez helped me to my feet and walked me into my house. As I sat on my couch, holding ice packs to both knees, I realized something had fundamentally changed. This wasn't just about pain anymore. This was about losing myself, piece by piece, to these failing joints. Most people don't realize this about chronic pain. It's not just the physical sensation. It's the way it colors everything else in your life. The way you start planning your day around your limitations. The way you stop making plans altogether because you're never sure if you'll be able to follow through. I stopped going to church because the pews were too hard and sitting for an hour was agony. I stopped cooking elaborate meals because standing at the stove for more than a few minutes made my knees throb. I stopped gardening, which had been my passion for 40 years. My beautiful roses, my vegetable garden, my herb boxes, they all became reminders of what I couldn't do anymore. My social life shrank to whoever was willing to visit me at home. Phone calls replaced lunches out. TV replaced walks in the park. I was becoming a prisoner in my own body, and that prisoner was angry. I snapped at my children when they called to check on me. I was short with cashiers at the grocery store when they tried to make small talk while I was clearly struggling. I became someone I didn't recognize, bitter, withdrawn, and resentful. But I don't know who needs to hear this. But if you're still here, maybe you understand what I'm talking about. Subscribe if you want to hear the rest. The breaking point came in 2018. My great-granddaughter Maria was turning 3, and the family was throwing her a birthday party at the park. I wanted to be there so badly. I could picture her running around in her pink dress, blowing out the candles, looking for Abuela Gloria to share her cake with. But the park meant walking on uneven grass, standing for hours, chasing after toddlers. My knees said no, but my heart said yes. I decided to go anyway and bring a portable chair. The party was beautiful. Maria was radiant, surrounded by balloons and cousins and laughter. I sat in my chair at the edge of the festivities, smiling and clapping, trying to be present. When Maria ran over to me with a piece of cake, her face chocolate-stained and glowing, she said, "Abuela, come play with us." She grabbed my hand, and tried to pull me toward the playground. "I can't, mi amor," I said, gently extracting my hand. "Abuela's knees are too tired today." Her face fell. Not with understanding. 3-year-olds don't understand chronic pain, but with disappointment. She ran back to the other adults, the ones who could chase her and lift her onto the swings and crawl through the tunnel with her. I sat there watching my family live their lives while I observed from the sidelines, and something broke inside me. Not my knees this time, my spirit. I drove home from that party and called Dr. Martinez's office the next morning. "I'm ready," I told his receptionist. "Tell Dr. Martinez that Mrs. Simmons is ready for the surgery." But Dr. Martinez had retired 6 months earlier. I was transferred to his replacement, Dr. Thompson, a younger man with excellent credentials and a reputation for successful knee replacements. Dr. Thompson reviewed my files and ordered new X-rays. When we met to discuss the results, his expression was grimmer than Dr. Martinez's had ever been. "Mrs. Simmons, I have to be honest with you. Your knees have deteriorated significantly since your last imaging. You now have severe bone spurs, significant joint deformity, and what we call end-stage arthritis. At your age, you're 79 now, the risks of surgery are substantial. Blood clots, infection, poor healing, complications from anesthesia." He paused, studying my chart. "And even if the surgery goes perfectly, your recovery will be long and difficult. You're looking at months of intensive physical therapy, and there's no guarantee you'll regain full mobility." I felt the walls closing in. "So what are you saying?" Dr. Thompson leaned forward. "I'm saying that surgery might not be your best option anymore. We can continue with pain management, stronger medications, regular injections, mobility aids like walkers and wheelchairs. The goal would be to keep you comfortable." Comfortable. That word echoed in my head for days. Comfortable meant accepting defeat. Comfortable meant never chasing my great-granddaughter across a park again. Comfortable meant watching life happen from the sidelines until I died. I left Dr. Thompson's office with a prescription for stronger painkillers and a heavy heart. The new medication helped with the pain, but made me drowsy and confused. I started having trouble remembering names, following conversations, even watching TV shows without losing the plot. My daughter Carmen noticed immediately. "Mum, are you okay? You seem different." I was different. I was chemically sedated, emotionally numb, physically limited, and spiritually defeated. I was comfortable, just like Dr. Thompson promised, and I hated every moment of it. That's when I read something that changed everything. I was sitting in my garden one afternoon, watching my neighbour's children play in their yard, when Mrs. Rodriguez came over with a magazine article she'd torn out. "Gloria, I read this and thought of you," she said, handing me a crumpled page from Prevention magazine. The article was titled, "The Patience Trap: Why Waiting After 60 Can Kill Your Dreams." It talked about something called the 60-year rule, the idea that patience after 60 is often just another word for giving up. My doctor had said wait. I stopped waiting. The article mentioned a guide with more information, and Mrs. Rodriguez said she'd found the link online. That guide is in the description below. The article described a woman named Margaret who had reversed her chronic hip pain using methods her doctors never mentioned. Not surgery, not stronger drugs, but a complete approach that addressed inflammation from multiple angles. The article mentioned anti-inflammatory foods, specific exercises that actually helped instead of hurt, and stress reduction techniques that had measurable effects on pain levels. I was skeptical, but desperate. What did I have to lose, except the life I was already losing? I started researching everything the article mentioned. I learned that chronic inflammation was at the root of most arthritis pain, and that certain foods could either fuel that inflammation or fight it. I discovered that my diet of processed convenience foods, sugary snacks and fast food meals was essentially pouring gasoline on the fire burning in my joints. I learned about omega-3 fatty acids, antioxidants, and something called the Mediterranean diet. Within a week, I had thrown out everything in my pantry that contained sugar, processed oils, or artificial ingredients. I started eating fish twice a week, adding turmeric to everything, drinking green tea instead of coffee, and snacking on walnuts instead of cookies. The changes seemed impossible at first. I'd been eating the same way for decades, but desperation is a powerful motivator. I found anti-inflammatory recipes online, ordered books about nutrition and arthritis, and turned my kitchen into a laboratory for healing. The second part of my new approach was movement, but not the kind of exercise that had failed me before. Instead of trying to power through pain, I learned about gentle, specific movements designed to improve joint mobility without causing damage. Water exercises at the community centre pool where the buoyancy supported my weight. Tai Chi movements that emphasized flow and balance rather than strength. Gentle yoga poses that stretched tight muscles without stressing fragile joints. I also addressed something no doctor had ever mentioned, the connection between stress and inflammation. 15 years of chronic pain had made me a permanently stressed person. I was always braced for the next wave of discomfort, always worried about what I couldn't do, always angry about what I'd lost. That constant state of tension was flooding my body with stress hormones that actually increased inflammation. I started practicing meditation, just 10 minutes a day at first. I began keeping a gratitude journal, forcing myself to write down 3 things I was thankful for each morning. I called old friends, joined a book club that met at the library, and slowly started rebuilding the social connections that pain had severed. The changes didn't happen overnight. The first week I noticed my sleep was better. The second week, the constant foggy feeling from the pain medication started lifting as I gradually reduced my dosage. The third week, I realized I'd walk to my mailbox and back without consciously thinking about my knees. But the real transformation happened on March 15th, 3 weeks after I'd started this new approach. I woke up that morning, put my feet on the floor, and stood up. Just stood up, without the usual mental preparation, without gripping the nightstand, without the sharp intake of breath that had accompanied every morning for 15 years. I stood up like a normal person, like the person I used to be. I walked to the kitchen without limping. I made breakfast without shifting my weight from foot to manage the pain. I went outside to check my mail, and on impulse I walked around my entire yard, something I hadn't done in years. My knees felt normal. Not perfect, not like I was 20 again, but normal, functional, free. I called Dr. Thompson's office and scheduled an appointment. I wanted him to see what had happened, to understand that there had been another option all along. When Dr. Thompson examined my knees and reviewed my latest X-rays, his expression was puzzled. "Mrs. Simmons, I have to admit this is quite unusual. Your range of motion has improved significantly, and you're clearly experiencing much less pain. The structural damage is still there. Arthritis doesn't reverse itself, but your symptoms have definitely improved. I told him everything I'd done. The dietary changes, the gentle exercise, the stress reduction. Dr. Thompson listened politely but dismissively. I'm glad you're feeling better, but I want to caution you about getting too optimistic. Arthritis is a progressive condition. You might be having a good period now, but the underlying damage will continue to worsen. That's when I got angry. Not the bitter, defeated anger that had consumed me for years, but a fierce, protective anger. Doctor, I said, 3 weeks ago you told me to accept being comfortable, to accept that my life was essentially over. You never mentioned that what I ate might matter. You never suggested that stress might be making my pain worse. You never told me there were exercises that could help instead of hurt. You gave me drugs and told me to wait for the inevitable. Dr. Thompson's face flushed. Mrs. Simmons, I provided you with standard medical care based on established protocols. What you did wasn't medical treatment. It was lifestyle modification. I couldn't recommend unproven methods. Unproven? I stood up, demonstrating my improved mobility. I'm the proof. I'm walking, I'm gardening again, I'm playing with my great-granddaughter. 3 weeks ago, you told me that was impossible. The conversation ended awkwardly. Dr. Thompson couldn't explain my improvement within his medical framework, and I couldn't accept that this improvement was temporary or insignificant. I left his office, knowing I'd never go back. It's been 8 months since that appointment. My knees aren't perfect. I'm still 82 years old, and I still have arthritis. But I garden every day. I chase Maria around the playground. I take walks with Mrs. Rodriguez every evening. I cook elaborate meals for my family again. I live instead of just existing. After everything I went through, I found the 60-year rule. It has 9 rules that explain exactly why everything I believed was wrong after 60. It changed how I see my health, my family, my future, everything. If anything I said today sounds familiar, check the description. Don't wait as long as I did. The most important thing I learned isn't about knees or arthritis or inflammation. It's about the difference between accepting limitations and accepting defeat. My knees were limited, the X-rays proved that, but I had accepted defeat, and defeat was a choice, not a medical diagnosis. I learned that doctors, for all their knowledge and good intentions, sometimes can't see past their protocols to recognize other possibilities. I learned that my body had more healing capacity at 82 than anyone believed, including me. Most importantly, I learned that hope isn't about denying reality. It's about refusing to let reality be smaller than it has to be. My reality now includes morning walks and afternoon gardening and evening games with my great-granddaughter. It includes feeling grateful for my body instead of betrayed by it. It includes believing that tomorrow might be better than today, even at 82. Dr. Thompson was right about one thing. Arthritis is progressive. But so is healing when you give it the right conditions. So is hope when you stop managing it and start nurturing it. So is life when you choose to live it instead of just enduring it. That's my story. That's how I got my knees back, my life back, my joy back. Not through surgery or stronger drugs or medical miracles, through remembering that I was more than my pain, more than my limitations, more than my age. Through remembering that even at 82, I still had choices, and the most important choice was deciding that comfortable wasn't good enough. not when there was still life left to live.